So good day. We are Group 1 buddies, and we are going to present our topic on elderly mental health disability in the York region. Myself, Piyush, and my group mates are Charu, Jessa, Maria, Joy. So, for the introduction, the elderly often face multiple challenges such as physical health issues, social isolation, and financial security, which can exacerbate mental health conditions. To focus on their mental health needs, we aim to contribute to evidence based planning for effective intervention and support services tailored to elderly group ages 65 and over years old.
So, why do we choose this topic? Okay, so first and foremost, we choose this elderly mental health disability in York Region, Ontario, because approximately 15% of York Region population is 70 to 74 years old and over. So they are more vulnerable as an individual. So prevalence of mental illness as well in York Region is also a concern in Ontario. Then healthcare access. So having difficulty in accessing the healthcare as well at this age bracket within 70 to 74 years was a challenge as well as an elderly mental health disability client. Then retirement and long-term care home as well. Next slide.
So presenting the statistics of the current data, according to the census released report of York region in 2021, the York region has a total number of seniors 19,09,185, an increase of 23% since the 2016 census. There are 70 to 74 years old residents, where the fastest growing 5 years age group from 2016 to 2021, growing by 43% of 15,915 people, while 14.2% of York region residents are close to retirement age 55 to 64 in 2021, compared to just 4.4% in 2001, that is from Regional Municipality of York 2024. And next is tools for assessment, like which tool we are using for assessing all that data. So our data has been quantitative, we have assessed it quantitatively, which means to evaluate methods that we use like quantitative data is when we use methods of numerical data to measure any assessments, and these numerical data takes the form of percentages to provide quantifiable metrics that can be easily compared or analyzed. And after a year of study, we can identify that how many elderly residents ages over 70 to 74 years old, they develop mental disability. This was the whole thing that we observed from our data, that we got from our data. And next slide please. Yeah, so reasons for why we choose this topic for our community presentation is that let's consider demographic data first. So for seniors in our community, as highlighted by the recent census, the number of seniors in York region has risen significantly, that I already told, which is 23% increase in 2016. This surge means that more individuals are entering an age group often characterized by the increased vulnerability of mental health challenges. Addressing the needs of this growth population is crucial. And next, we must acknowledge the unique challenges that the elderly faces. Many seniors experiences physical health issues, social isolation, and financial insecurities, all of which can exacerbate mental health conditions. These factors create a complex web of challenges that require targeted interventions and support services. In light of these challenges, the important effectiveness of care and support system cannot be overstated. We need to ensure that our healthcare and community services are equipped to provide the necessary mental health support. This include access to counseling, social services, and community engagement programs specifically designed for the elderlies. And moreover, we also have policy development in this. So policymakers need to recognize the mental health needs of seniors and allocate resources accordingly. By understanding the unique challenges faced by these demographic, we can advocate the policies that promote better mental health services, ensuring that our senior receive care that they deserve actually. And next will be resource allocation. In another critical aspects, with limited funding and resources, it's essential to direct efforts towards programs that effectively address the mental health needs to elderlies, and implement some strategies to allocate which will enhance their service availability and ensure they are both accessible and impactful for them. And lastly, we have humanitarian and ethical imperative to address the mental health of seniors. As healthcare professionals and community members, we have a responsibility to uphold the value of autonomy, informed responsibility to informed consents, and beneficencies. We must strive to improve their quality of life and ensure the ethical considerations are at forefront of our interventions. Thank you. Next slide, please. Maria, mic.
For the ethical consideration, we have autonomy, informed consent, beneficence, non-maleficence, justice, quality of life, and end of life. For autonomy, respecting the elderly person's right to make decisions about their own life, including healthcare and living arrangements. This involves informed consent and understanding their preferences and values. For informed consent, it should be always take into consideration that even though they are old enough, they have the right to be informed of whatever care or services the provider will and the patient will get it. And the beneficence, acting in the best interest of the elderly, providing care and interventions that benefit them while minimizing harm. For non-maleficence, avoiding actions that can cause harm or suffering to the elderly. This includes considering the risks and benefits of medical treatments and intervention. Justice, ensuring fair and equitable access to healthcare resources and support services for all elderly individuals, regardless of their socioeconomic status, ethnicity, or background. Quality of life, ensuring that the best approaches of health of care for the elderly are into the highest priority. For the end of life, providing compassionate care that respects the wishes of elderly regarding end of life decisions, including advance directives and palliative care options. Stakeholders are very important in the circle of care for elderly, such as the patient itself, caregiver, family members, providers, advocacy organization, and policymakers. Those stakeholders must be involved and engaged throughout all phases of research or all the healthcare plan to ensure the appropriateness or even in the study feasibility for the care for the elderly.
So for our summary, as our group presented the elderly mental health disability in the York region, it summarizes the importance of mental health challenges due to physical health issues, social isolation, and financial insecurity. With the increased average of 15% of senior population aged 70 to 74 years old, it is noted that mental health needs are crucial and critical. With a quantitative assessment tool, our group identified and addressed mental disabilities among elderly that highlight the significant ethical considerations and effective support services. So here's our references. And that's all. Thank you.